Thank you for tuning in to watch our Invest Minneapolis-St. Paul Leadership Summit. You're about to watch panel number 3, Beyond the Clinic, examining Minnesota's healthcare performance and leading the charge in reimagining the future of the industry. Don't forget to like and subscribe to watch more videos like these. Enjoy. I'd like to start off a question for all of my panelists to answer, which is, what structural or cultural factors have enabled this high performance? And what is your organization doing specifically to help scale these efforts nationally? Jeremy, let's start with you. And because I butchered everyone's name and title, could you please repeat it for everyone? Thank you.
Sure. So first and foremost, congratulations on your daughter. That's fantastic. My name is Jeremy Cauwels. I am the Chief Medical Officer of Sanford Health, an organization headquartered out of Sioux Falls, South Dakota, but that has a tremendous amount of healthcare in Minnesota as well. So we're very happy to be here. To start in on your question, I think one of the things that Minnesota identified very, very early in healthcare is that you get results on what you measure. And so the Minnesota community measures were one of the first places in the country where you had a baseline, where hospitals were coming in and saying that this is how well we're doing things. That baseline allows everybody, every hospital in the and every community to understand a little bit about how they rate compared to other folks. I think that is always a good way to get started if you're going to look for how do we draw a baseline, how do we make sure that care continues to improve in the areas that we are. For Sanford, I think the story I'd like to tell you is probably biggest around access to care, particularly in this case, rural healthcare. I mentioned at Sanford, one of our major hubs is in Bemidji, Minnesota. So if you haven't been up to see Paul and Babe the Blue Ox, please, stop by and say hi. But in the counties around Bemidji, the ability to deliver a baby has disappeared completely in 3 of the counties around on all 4 sides of that community. I think the biggest part of it is we have the only 4 OB docs for maybe 60, 70 miles in any direction, maybe 90 in other directions. And we recognize the fact that we weren't going to be able to take all of those pregnant mothers and bring them in for every single visit. Hundreds of miles is not a reasonable travel in order to make it in and out for a 10-minute OB visit. So we started sending moms home with little rally packs. Those rally packs have a fetal Doppler and a blood pressure count. And moms are starting to learn what their blood pressure really should look like. So they know the number. It's not the number the doctor read off the wall. It's the one that they read. We can make that access then available to them via Wi-Fi. We can do it via their local emergency rooms, which are still opening. But of course, if somebody comes in pregnant, they're like, you should really go anywhere else. And so we want to make sure those communities that have the access to call in, and they can do virtual visits with our OB docs. They can do in-person catch-up visits, and they're actually closer to the ACOG, American College of Gynecology, ACOG guidelines for keeping up with day-to-day care and appropriate prenatal care than they ever were before because of the ability to deliver that care virtually and face-to-face when needed, and the ability to triage you in an emergency room that wasn't equipped to deliver a baby, but has the expertise to get you on the phone, on a video visit, or on a direct line with somebody who delivers babies for a career and says, yes, this person needs to come the 100 miles. This person doesn't, and you can watch them there. And I think those stories tell us a tremendous amount about whether you're 100 miles from care or whether you're 10 blocks from care. It can be difficult to get there either way. And how do we make sure those connections matter more to our patients and how they make a connection than it does to the bricks and mortar of healthcare?
It's a really interesting way of solving that access problem. Dominica.
Thank you, Abby. So I just want to say too, I'm so happy to hear about your daughter. And I will just say, so healthcare is local and it touches all of us. And so I think just to back up a little bit, Dominica Telrico, Chief Operating Officer at Allina Health. I'm new as well to the Minnesota market, although spent my summers growing up on Pelican Lake and Detroit Lakes where my grandparents have a home, but equally moved here a couple of years ago, and my husband and I, and only to find that he too experienced a cancer diagnosis.
Yeah.
And after doing a lot of research and a lot of second opinions, we found we were right here at home at Allina Health with the world-class bladder cancer treatment specialist. And So just to say that, I think that speaks to the level of care and the quality of care, which I know from an employer perspective is really important in attracting employees to come and work and live in the Twin Cities and in the markets around the Twin Cities. So I think that what I have experienced that has enhanced, I think great technology has exploded and it really has allowed us to reach people. We like to say when, where, and how people need us. So whether that's physical, whether it's virtual, whatever that might be, in the home, in our facilities, also in some of the agencies and public spaces where we can reach our community. But it's the collaboration that we have. So the collaboration among our caregivers, so our providers in the community, our payers, and our public agency, that we really work to integrate that care and coverage and the access points. I think, thank you so much on the, touching on the technology. And there's so many examples of that. As Allina Health, we provide tertiary quaternary care. We also reach out into our community hospitals, not just those that are part of Allina Health, but across, Minnesota, also other states, including Western Wisconsin and other areas. And we're able to bring specialty care local so that people don't have to travel. So we try to treat cardiac disease, nephrology, any of the disease states. An example of that is we recently launched AI, where we can now monitor seizures in patients locally in the hospital, rather than having them transfer into the Twin Cities, doing the monitoring only to find maybe they could have been cared for close to home. We do that with cardiac disease, et cetera. So I think that collaboration really, truly is the secret sauce. And coming from the Chicago market, I worked for my whole career in the Chicago market, whether in academic medicine or integrated health systems. That's a unique factor here in Minnesota that I really do find that spirit. So thank you.
Thank you. And Krista.
Yeah, and we certainly didn't make it easy on you with our last name. So thank you. Krista Skarupa, very nice to be with you here this morning. I'm our East Market President at Essentia Health. So on behalf of our 15,000 colleagues at Essentia Health, we're headquartered in Duluth, Minnesota, and I'm representing really truly all of the greater Minnesota, but we serve patients in communities from Bismarck, North Dakota, all the way to Northwest Wisconsin. So, mid-urban and rural is really what we do best. So I'm so happy to be with you here this morning. I'm going to build off of what several panelists have said and shared with you this morning and what my fellow colleagues on stage have shared. I think there's two factors, one structural and then one related cultural factor that really separate Minnesota from others. And I've had the pleasure of leading in care delivery in Minnesota for nearly 2 decades. This is my third integrated care delivery system. And certainly what Dominica shared, I have to echo that. I mean, it is a special place. I talk about with my colleagues across the country, this idea of cooperation, where we're certainly all competitors and we compete certainly when we know we need to, but we understand the power of collaborating for outcomes, not only within our organizations, but with community partners and with each other when we know it brings more value for the communities that we serve. And then I think it was Damon that said it on the first panel. I'm going to remember this land of 10,000 nonprofits, because I do truly believe that is what's also special in Minnesota, is that care is delivered primarily by those of us in the nonprofit space, which means that we are not challenged by competing interests of our shareholders and stockholders and our patients. We are all mission-driven organizations, and I can tell you at Essentia Health what is very special is that our culture is built on a firm foundation of our values, and we're deeply committed to the communities that we serve.
Thank you.
Another question for all of my panelists, and maybe Jeremy, I'll start with you again. From behavioral health to preventative care and telemedicine, what areas outside the traditional clinic setting are seeing the most momentum? And what's, in your view, is holding them back from wider integration?
So I think one of the things that we've seen stemming out of COVID is that more than 20% of our mental health visits are still virtual. Whether it be the stigma of not really wanting to have, let's face it, I come from small towns. I drive a blue Ford pickup. I'm not sure anybody wants to see my blue Ford pickup outside of the psychologist's office. So it's real in lots of places that you have to be able to be flexible in order to make sure you can meet those patients' needs. For us, that means that we're encouraging virtual care. In fact, we're encouraging it to the point where we've hired now throughout the system 70 integrated health therapists. So these are master's prepared mental health workers that are on call and ready for our primary care doctors. Should they have somebody that comes into the clinic with anxiety, depression, something that's going to take more than that 10-minute primary care visit that we all recognize. And rather than saying, you know what, we'll get you set up in a few weeks and we'll see how you're doing, they can make that handoff real time. So they can say, hey, you know, if you're one of the lucky clinics to have one of those 70, I have an IHT here that wants to talk to you right now. If not, our commitment is that by the end of the day, that person will reach out and talk to you and catch up on whatever mental health issues you're having, no matter where you are in the system. They're already ready to make virtual care visits, whether you be in Bemidji, Minnesota, Verne, Minnesota, Worthington, anywhere along the western side. We make those connections to make sure that as people are going through, we recognize the fact that our virtual care is currently sparing people 176 miles on average for every visit. That means for many people, that's a half a day or more off of work, especially considering doctor's offices always run on time. Getting them in and out of there, making sure you don't have to pull your kid out of school for half a day, making sure you don't have to miss a half a day of work. And you can take your mental health visit in your car on your break during your work day is something that really matters to the patients and really allows us to drive home that if you come in with something like that, we're going to answer the questions and we're going to answer them as soon as you need them, not on our schedule, but on the patients.
Thank you. Thank you. Dominica?
Yeah, thank you, Abby. All well said. And I think what I'll index on is the transformative time that we are in healthcare. I mean, economically challenging. We all know about the OBBBA, and we're going to assess the headwinds that will have on us. However, that goes without saying that this is a transformational time in healthcare with AI, gene editing, new technologies, biosimilar pharmaceuticals where you can actually cure cancers. This is an amazing time. And so for us at Allina Health and in collaboration with so many, we really are focused on bringing those new technologies and solutions from prevention to treatment to our communities and even beyond our communities. We often service a 5-state region and recently launched incisionless brain surgery for essential tremors, right? We use AI to detect triple negative breast cancer, lung cancer, colon cancers, et cetera. So we're working in research to look at cures and early diagnosis of Alzheimer's and prevention of Alzheimer's and the progression of that. So I think the comfort for all of us who live here in Minnesota and specifically in the Twin Cities, we too, and thank you, Krista, for mentioning about mission and values and vision. We are so committed, and it really is. We are all engineered around not-for-profit healthcare, and the mission is in service to the people. For Allina, we've been in service to the communities for 140 years. We're anchored our corporate office, as well as we're investing $1 billion in the reinvestment of Allina Abbott Northwestern Campus, which is on South Minneapolis. And people questioned that when we first looked at making that reinvestment. Should we go out to the suburbs? Where should we build this campus? And it was just very clear to us that it really was to remain in the Twin Cities, and it was to remain on the south side of Minneapolis. So we're very excited about that. I think that, what comes ahead is really amazing. It also is, we have to focus on the affordability factor, because all of these transformative treatments and diagnoses and products that are coming out. We all know you're all employers as well in the room here, as are we. And, one injection of a drug can be $1 million. It can save a baby's life for the rest of their life, so we have to do it. We want to do it. How do we pay for it? And I think that we're all sitting here, also sitting in the, week of what does the OBBBA mean? What does it mean to not have coverage for many people? Because they're still going to need care. Whether you have coverage or not, all of us here will be taking care of our community, likely coming in through our emergency department and other places and spaces. So it's $1 trillion. I don't know if folks are aware of this. It's $1 trillion that is coming out of the healthcare value equation with the OBBA. So there are some challenges ahead.
Certainly. Krista? Can you hear me now?
Yes.
Okay. I'm going to build off of what you just said once again. I've often heard this moment in time described as the silver tsunami, where the aging population and their care demands are starting to significantly exceed the U.S. healthcare system's capacity to meet those care needs. And so truly, we absolutely understand now that it is no longer really a nice to have. It is an absolute necessity that we focus more on those upstream factors that have a much larger role in contributing to one's health and well-being. And the humbling stat that I know Jeremy and Dominica and I are all acutely aware of is that only 10 to 15% of any individual's health and well-being has anything to do with what the three of us are working on. It's a humbling stat. That means 90% of someone's health and well-being has everything to do with like we've been discussing here today. Affordable access to housing, food access, where you live, education, right? So as an industry, we are really acutely aware of the need to focus on those upstream factors and partnering with others that to really impact the health and well-being of our communities. And I want to share one thing that Essentia Health is doing to make those important connections for our patients to those community partners. And I'm joined by my leader in population health today, and I want to thank Dr. Cantor for being here. She and I are both family physicians, and it's long been a challenge when we have a patient sitting in front of us who has been very challenged with safe food access. And we were recently recognized by the American Hospital Association for a referral platform that we have in our electronic medical record, that I'm able to place a direct referral to Second Harvest when a patient says to me, I do not have access to food. And that direct referral is placed and Second Harvest reaches out to my patient and helps address that need. It's just one example of many of what we're doing at Essentia Health to really address that whole person care through community partnerships.
And Krista, if you don't mind, let's drill down a little bit further. How is Essentia Health rethinking long-term strategy to move beyond critical care into broader determinants of health, such as housing, as you started to touch upon, food insecurity, and mental health?
Yeah, thank you. So I just described what we're doing kind of really on that individual patient basis. And we screen every patient that we have the great pleasure of supporting for those key social determinants of health. But let me talk about what we're doing on a broader scale, really strategically to help support those community partners, many of you in this room that have much bigger impact on those key factors. And I'm going to talk about housing. In the community I live in Duluth, and we go through an exercise, all three of us, of doing a community health needs assessment. All of our communities have one thing in common. They want optimal health and well-being. They want to be healthy and access to high quality care, but they all have unique needs. And in the Duluth community, it's housing of all levels. And Essentia Health has, certainly the largest employer in Duluth as well, wants to be part of that solution. So what we've done strategically is we are aligning our community contributions to support those that are working on housing initiatives. We've also developed our own hillside home ownership down payment assistance programs. We have housing rehabilitation, forgivable loan programs. And I'm really proud that at Essentia Health, this will translate into 200 additional deeply affordable and affordable housing units over the next several years in Duluth.
That's really amazing. Dominica, also, I'd like to drill down a little bit more. In the nonprofit space, how are you balancing mission with financial sustainability, particularly in serving underinsured or uninsured populations? And what changes are needed from a policy standpoint?
Well, I think I'll start with the policy, which is, I think people have been talking about what are root causes, and I talk about transformation and the innovation. We need the reimbursement and regulatory stances to keep up with innovation. So we can provide care in the home. We can provide care through telemedicine. We can do all sorts of things. We need to be paid to provide that care. So I think that given the economics, we just need to keep regulatory policy changes pace with the innovation, as well as, we talked about it here. There's going to be huge challenges with the federal and state budgets that were recently passed. And so how do we make sure that our community and our citizens have access to care, even if their coverage may not be there? So we'll continue to do that as not-for-profits. It's what we do every single day. I mean, at Allina Health, 70% of the people that we care for are on government or, some sort of subsidy programs. And so we do that every single day. We'll continue to do that. I think equal, like Krista and Essential Health and others, our board actually decided, so we partner very much throughout the community. I'm on the board of Second Harvest Heartland. It was so good to hear you say that. Food is medicine. I think it's critically important that people have access to food and nutritionally based food programs as well. So our board actually put together an impact investing fund. And so what we've done is we equally have invested in housing. I can see the housing complex that was built based on monies that were provided by Allina Health. And it's right outside my window every day at work. And I see it and it's an amazing thing. And we actually have a couple of employees who take advantage of that low income housing. We have invested in the federally qualified health center that's rebuilding just down the street from Allina Health, Abbott Northwestern. And so helping them from a grassroots effort, keep their doors open. It's really critically important. And as was talked about, we partner really across the board, whether it's food insecurity, employment, housing. And it is very true that, your zip code just determines quite essentially those, your health outcomes. And so we have to change that. We want to make a difference in that area. And you can only do that through partnering because we can't do it alone. I think gone are the days where you feel like as a healthcare organization, it's like, can we solve all these problems? We alone cannot solve all the problems. We have to partner with our community partners who are much better at doing that than we are. And they know what the solutions are, but they need partnership, they need funding, they need those creative, innovative solutions. So we continue to do that. And we will do more of that. Thank you.
That's wonderful to hear. And Jeremy, how is Sanford Health using AI, data analytics, and digital health tools to improve access and solve for providers' shortages challenges, especially in the rural communities we serve?
So I'm going to change direction just a little bit from where you guys were at, although I've got to tell you the community needs and, making sure everybody has access to it is absolutely critical to the work that we do. But where I'd like to take it is, without a show of hands, think of anybody who's been to a doctor's office in the last 5 years. And did you talk to the doctor's face or did you talk to their right or left ear as they were typing into the computer? We've made some changes in the way that works. Thanks to ambient listening and large language models, we're now able to actually put a listening device in between the patient and the doctor that starts writing my note for me while I'm seeing the patient. I think it's critically important to recognize that the reason all of our healthcare providers got into healthcare was to be nose to nose with the patient. And what we're getting back to finally is the combination of the cellular phone or other listening device, the computer is getting us back to being nose to nose with the patient again. So ambient listening and AI are able to bring us back to a spot where not only are patients much happier with their care, and I can prove that in the numbers, but doctors are actually happier providing it as well. I don't know since I jumped out to administration from full-time clinical practice about 7 years ago, I've ever had 95% of anything I've ever done be lauded as my physicians as making my life better. But ambient listening technology makes 95% of our physicians' life better. They're getting home earlier to see their kids. They're getting it with the paperwork done, so they're not sitting on Epic for 2 hours after they get home. And one of my partners who I've known literally for 20 years since I've been in the business, and I know this is the type of guy who worked for 2 hours every night on his electronic medical record after dinner, got home at 5 o'clock, ran into his 16-year-old daughter, and rather than diving into the electronic medical record, went out and helped her buy her first car. And he said, this is now my new routine, not buying cars for his daughter, but getting home in time to actually talk to my family, to not have this hanging over my head. And by the way, his patient satisfaction scores, as he's gotten happier, have gotten happier as well, because the patients know that he's more connected with them and less connected with the computer over his shoulder.
So what you're saying is that the ambient listening is going to create more Oprahs. You get a car, you get a car.
I don't know if my partner would let me say that yet. Certainly his kids would love to hear that. But
Sure they would. Well, excellent. I'd like to pose one last question to round out our discussion today to all of my panelists. If we were to fast forward 5 years, what would you hope has fundamentally changed in Minnesota's healthcare landscape? And what do we risk if we don't act with urgency today? Jeremy, do you want to start?
Sure. So to me, I think the virtual option for care is going to have to be a bigger part of 5 years from now. My father's 75 years old. He still gets dressed up to go into the clinic. My daughter is 17 years old. She expects that her doctor will see her over a bowl of cereal between swim practice and going to school. Now, if that isn't a paradigm shift for everybody in this room, I want you to rethink that. She's not considering the possibility that she would have to go to the clinic to see her doctor. And for all of us to make sure that the bricks and mortar of healthcare don't dominate the landscape, we're going to have to move that way too. We're going to have to understand that the paradigm of somebody walking up to the door and goes, the doctor will see you now, is going to have to change to the patient will see you now, and you better be ready. If not, hims, hers, GLP-1s online, whoever you want to talk to, will get into that business. And our job is to make sure that we're just as accessible for all of our patients as anybody else they can find online.
Excellent. Dominica?
I think that was really well said. I think what I would add to that, because I believe that the consumer first and meeting people when, where, and how they need us. So we have to lean into technology. There are workforce shortages. There are training shortages. We have to lean into technology and not have to in a bad way. It's here. It's amazing. It can change the lives of our caregivers and our care team members and the people we're so privileged to serve. The other thing that I would say is continuing to work on breaking down silos. So as we collaborate and we partner, I think more and more just making sure that what we're doing is for the fabric of healthcare across not just Minnesota, but our nation, is that it really requires collaboration, partnership, and we have to break down the silos. I think the technology, also electronic health record, and having interoperability so that people can go anywhere and everywhere, and you can see, people can see your care. We're an Epic user shop. I think that more and more that we're seeing that investment so that we can break down barriers to care, create access, and do that through partnerships. And we're, again, just so privileged to serve the community and the people that come to us every single day. And we'll continue to invest in that.
Excellent. Krista?
And I'll wrap us up. We had better feel as though we have made significant progress in our transformation of our care delivery system to provide more value for those that we're privileged to serve. I want to sit across from a patient 5 years from now, and I want them to tell me that care has never been more accessible, more affordable, and it's that same high quality that they expect out of us right now in the state of Minnesota. And I'm happy to report that at Essentia Health, we're taking the bold position that we're going to lead that change within. We know it's going to require partnerships with our community partners and our business leaders and our lawmakers and our payers. But we are optimistic and bullish because we know that our communities are counting on us.
Well, I'm sure I speak for everyone when I say that I'm so happy that we have these leaders leading the path in Minnesota. And please give panel 3 a round of applause.